I guess I'd make two observations. The first is that China is much more nakedly self-interested in the way it uses aid, particularly in resource-rich economies, it's using aid as a lever to assist it in its endeavours to soak up resources effectively. There's a lot of that happening in Africa, but also in other parts of our region. So that's the first thing. They have a very utilitarian view of it. They're not focused on the global public good or on broader humanitarian goals. They're focused on a very transactional approach to aid. But the second thing I would say, though, is that there's a positive to their self-interest, and that is they do, and this particularly applies in health, they do understand the risks and threats out there. They would completely understand the presentation I've just given, and they're very focused on it. They mounted a huge response to Ebola. They went to West Africa, and they were very active there. There are large numbers of Chinese nationals in Africa, and they're very aware that they are increasingly interconnected in the world. So there are opportunities to work with China in the self-interest lens, which is not a bad thing, on issues of common concern. So that would be my observation. It's very hard to do. Australia's had a dialogue with China at government-to-government level about working on cooperation issues over many years, and the end result is one fairly small cooperation on malaria, in fact, in Papua New Guinea. It's not a lot, but it's something. So they're quite wary of working with the traditional donors, but we have to continue to pursue that opportunity.
Yes, I don't think I've got much more to add. I think Bill's summarised it. I mean, I made the comment because in both Global Fund and GAVI, China started as a recipient, but they used it very much as catalytic, which was really, it was a very constructive and productive way. So they would say, if we could work together, if you would be prepared to invest in this many provinces, and we can prove the concept works, then we will be able to persuade the government as a whole. So, for instance, GAVI, we did that with Hep B, worked in about 5 provinces, I think. We worked very collaboratively with them. They implemented it. They were able to show the reduction and how important it was, and they were able to nationally roll it out. So they were very pragmatic about that. In discussions with them about becoming investors in the 2 organisations I worked in, they've not been as interested in doing that because they really much prefer to partner and to do their own thing. I think that's quite clear. But they're very pragmatic. I agree, and their health system is, and their response to issues is very pragmatic. If I can tell you a story, it's probably out of school a bit, but I know maybe about 9 years ago, they realised that they probably had a fairly major issue of HIV infection amongst men who had sex with men, but it was not something that they really, as a government, could recognise. So they approached the Gates Foundation and said to the Gates Foundation, we think we have a problem, and Gates Foundation said, yeah, we think you've got a problem too. Said, well, if you want to fund or organise for some non-government organisations to provide services, then we're happy to do that. Of course, we won't recognise it, but we're happy to do it. So they have a very pragmatic approach. Is that fair enough, Bill? But very realistic.
Great.
Yeah.
I know there's a question from the audience over here.
Thank you so much for such a wonderful opening to the forum this year. Speaking about self-interested aid, I guess my question relates to another form of funding to lower middle-income countries, the diaspora remittances. And I've wondered how might they be leveraged to actually cut across sectors in economies. And I wonder if you have any thoughts about diaspora remittances as a form of aid and for lifting people out of poverty in lower middle-income countries.
Yeah, do you want to take that one?
I can say that there's a whole kind of economic literature and debate about this, that there are quite mixed views about whether funds that are remitted back to those countries are invested productively or not. They certainly can keep people above the breadline, which is a good thing. There is a question about, though, whether, or can you or should you try to get those remittances invested in a way which, increase productivity, economic activity, and so on and so forth, to get business moving, to get social investments. And I say also that there's a big question about that, because these are individuals making the choices that individuals make. So you would have to have a very strong reason to want to compel them to invest their funds in a certain way. And we would really discourage the idea that governments, for example, might have the ability to intervene and channel funds in a way that the government saw as appropriate. But what you can do, perhaps, is create opportunities and incentives and schemes that are attractive to individuals in which they choose to fund. I would say, I'm not aware of many, I'm not an expert in this area, but I'm not aware of many examples of that. The first call on remittances will be individuals supporting their immediate family members. But it is an area of interest. And the other thing I will say is that there are increasing numbers of high net wealth individuals in Asia. And the very interesting question is, where's the Asian Bill Gates, is a very interesting question. And that's something we should be thinking about as well, as opposed to just thinking about the only place you can make money is in the developed world and send it back. Helen?
Yes, I'm certainly not an expert on remittances, so most of them at this stage go to individual families, as you say, and I think that the slide you showed, Bill, is very compelling about the out-of-pocket expense, because that is a huge issue for many of these countries where you don't have strong health systems and you don't have health insurance. The out-of-pocket expense is much higher than we have, and for people on poverty line, they simply can't afford it, or they go into even deeper debt. So remittances have an incredibly important role to play there, and I know anecdotally, without having any documentation on it, that when the global economic crisis hit and the remittances slowed down coming from Europe, it was actually, we would hear accounts of it really hitting individual families. I think the whole business of high net worth individuals in our region, but also in Africa, is a really interesting one. And certainly there's quite a lot of effort to mobilise. I mean, if we talk about Bill Gates has a scheme where he actually invites billionaires to contribute, not to anything he says they should contribute to, but he talks to them about making a contribution back if they have that much money. And in fact, I know that with the Global Fund, Nafisah Mbowe, who was the Minister for Health in Indonesia and was chair of the Global Fund most recently, she, with Bill Gates, actually got 5 high net worth donors in Indonesia to provide a considerable amount of funding to Global Fund. So there's more and more of that happening, and there's more happening in Africa as well. But it's certainly something interesting to watch because there are some very high net worth individuals there.
Thanks, Helen. I know Connor's been desperate to ask a question about health security.
Thanks very much. So I think what Ebola showed is that the WHO is perhaps not fit for purpose, and it certainly doesn't have the economic or financial reserve that it needs. And so the World Bank's come out and it's convened the Rockefeller Foundation, a whole bunch of organisations to come up with the PEF. And what I'm interested in is the World Bank any better positioned as a governance body to sort of take that money as an insurance fund and then roll that out so that people do have better health or improved health outcomes when we see the next pandemic? And if not, then who is?
Helen will definitely have a view on this as well. So my view on that is that the WHO is a health body, and its comparative advantage is in the things that Helen described earlier. The setting the standards in health, the technical issues, the global health surveillance network, and all of those kind of issues. But Global Fund is not primarily about financing. And financing is I've made the case, and I hope you accept it, is a huge challenge in the health space. The World Bank is about financing. That's what it's for, okay? And so as are regional development banks like the Asian Development Bank, that's what they were created for. So my argument would be that it is an appropriate space for the World Bank to operate. The World Bank is also increasingly focused on its role in global public goods, and that's what health security is. It's a global public good. And a global public good is something they should focus on because, like a regional public good, it's something that a country itself won't tend to pay for. So you have to have a way to pay for global public goods, and that is a logical role for the World Bank to be. Now, those two have to play nice with each other, and that's always a challenge. But if they do, they should be highly complementary to each other in principle.
Yeah, I would agree, and I think that Dr. Chan, who's the Director General of WHO, would be the first person to agree that they don't have financing, they're not a finance body, and they don't have financial expertise. They obviously do a lot of analysis of spending, but they're not a financial institution, and the World Bank is the place to do it. The World Bank itself has, until quite recently, withdrawn a lot from health and nutrition. And that was a big problem because they weren't actually filling that space. They were focused on macro infrastructure projects and not on health. But that's actually shifted, and I don't know, Bill, whether you would, from your government point of view, you would say that's shifted. I think I think since who's the president? Jim Kim. Sorry, thank you. Momentary lapse. I think since Jim Kim came in, not surprisingly, but also there was a significant amount of pressure from other global health organisations to say the World Bank's missing in action, where are you? And they've come back with a vengeance. Now, if they take that over, and in fact, as you say, if World Bank and WHO can play well together, that would be a way forward. But there isn't a clear solution. But I would have thought the World Bank would be the better and probably the more obvious place to locate it.
While you still have the microphone, Helen, I just want to quickly follow up with the criticisms that you made of WHO. You described it as political, bureaucratic, timid, overstretched and slow. Not to put too fine a point on it. Is there any hope for the World Health Organization, or should we move on?
Those phrases, I should say, I'm quoting from reports in the public domain. but I wouldn't disagree with them. I think it's well, and this is a discussion that's when I was in government, when I worked with the Ministry of Health, and I used to go and represent Australia at WHO. There were lots of discussions amongst various donors about should we leave the World Health Organization to implode, or should we work on reforming it? And now this is a long time ago, but Gro Brundtland, who was the former Prime Minister of Norway and a doctor, she actually stood on that platform in 2000, I think, as the Director General to try and reform, and in fact only stayed for one term. It's a big issue. I mean, you absolutely need a global organisation. You need a global organisation with that technical expertise, that convening power. I think that's absolutely invaluable. I think, I don't know what the answers are, but I think that the weight of the UN bureaucracy is a problem. I mean, people in WHO and talk about the golden handshakes. You have people who are employed there, very bright, very good in their field, but are probably ready to move on. But actually, to attract and retain people in international organisations, they actually get very good remuneration packages. And for many people, it's actually too difficult to leave. And it's very hard to move people on. So it's not a nimble organisation, and it's not able to restructure and pull in people. And I don't know what the answer to that is. I mean, it's an issue. Bill, you would probably have comments. An issue, I think, across other UN agencies too. Yes, absolutely. You know, there are some fantastic people. They're key roles they play that no one else could play. But I think, I mean, things take so long, and it's so slow to get things done, and it's very hard. They find it very hard to change. And you know, when you, as you say, when your governing body is 198 members, it's, you know, it's not what you'd call light and nimble in terms of changing things.
Yeah. Bill had another comment on this question, and perhaps even a follow-up here. Why did Australia's Ebola response take so long, and why did we require a private company to undertake the work? But perhaps if you could finish by responding to that question.
Thanks. I just also want to comment on the WHO. You know, you get the WHO that you deserve as a member country, right? So there are lots of problems in the staff and the bureaucracy of the WHO, some of which, by the way, are just a function of the fact that when you have humans from a whole range of cultures and practices, you have to have bureaucracy is the culture. That's the common culture, right? I worked in the Asian Development Bank, and I've sat in a working group with a Korean and a Japanese and a German and myself. We were trying to reconceive capacity building, if you've heard the term capacity building. We didn't even have the same understanding of what we were talking about. And it took us about 3 meetings to realise that. So bureaucracy is a way of creating a common culture. So that's part of what's going on there. But the thing about the WHO, like all UN organisations, it is a common problem. It's the member states who effectively set the rules, and they pay the bill as well, or don't pay the bill, as the case may be. And in the case of the WHO, here's a good little takeaway for you. The 198 countries contribute in the form of their membership contributions less than one man, Bill Gates. Okay? So you get the WHO you pay for, basically, and we don't pay very much. On Ebola, I just want to talk about the Ebola response in WHO before I come to Australia,
Sure.
if that's okay. Because I had been working in, and this is a point I want you guys to ponder if you can, I had been working in the humanitarian sphere immediately before I came into health, and I was used to the whole global humanitarian architecture and the way it works. When, you know, there was the big typhoon in the Philippines a couple of years ago, major international earthquakes, and there's a whole architecture of the UN and of others, the military, they move into action and they all know how it works and they broadly know what to do. Now it's still a mess when you get on the ground, but that's because it's a messy situation, but there is a system. The UN Office for the Coordination of Humanitarian Affairs tries to manage all the coordination, get the information out, etc., etc. My observation about Ebola was that none of that showed up. And the question is, why not? And I think one of the big challenges and lessons learned from Ebola is, why don't the health and humanitarian systems work together very well? I just couldn't believe that people weren't turning up. My other observation is that in the field of peacekeeping, which is another sort of field of international affairs, you'll assemble a regional force of neighbours and they'll go in and help. None of the neighbours showed up either. Why not? So there's some really big questions about why is there no architecture for health emergency response, and what do we do about that? Coming to Australia, do you want me to keep going?
No, coming to Australia, because then we have just time for one more question, so we do need to wind up.
Okay,
Yep.
so I'll make 2 points about the Australian Ebola response. The first one is that as a public servant, one thing you really love from your political masters is clear guidance, and we got it, okay? The guidance was as follows. Our first priority as a government is to protect Australia and Australians, and that's actually more complicated than you think, because the monitoring of the global system happens in Canberra at the Commonwealth level, but the delivery of the health services at the state level, and of course it's below that. You might recall that you might or might not recall, but fairly early on in the day, there was a nurse self-reported in Cairns as a possible Ebola case. Now, where was the nearest emergency Ebola treatment centre? In Brisbane. There's a problem with that, right? We didn't have a plane at that time that would actually, had she been positive for Ebola, we didn't have a plane set up ready to go to actually safely transport her to where she needed to go. So any government is always going to prioritise its domestic issues first. The second thing the government didn't want to do was import cases. So you'll recall, if you travelled at that time filling out your Ebola card, we had to put in place a whole myriad of arrangements to essentially monitor and manage who was coming, and I'd be able to identify those passengers who are at risk and get them into the state health services, back to the state health services, so that there was a monitoring regime. The third thing the Australian government was worried about, what if it comes to our region? We're not responsible for West Africa, but we sure as hell are responsible for Timor, Papua New Guinea, the Pacific Islands and so forth. Were we equipped to deal with an Ebola outbreak in Port Moresby? Because nobody else would do it except Australia. So that was the third priority of our government. And then broadly, conceptually, the fourth priority was what contribution can we sensibly make to the global Ebola response? So I think that was what, and Helen will agree with me, you don't often get clear guidance like that, but we got it and it was great because we knew what we had to do. Now on the question of why did it take so long and why did we go the way we went? So the first thing was, and again it all makes sense in the context of the framework I just described, this government did not want to have Australians infected with Ebola in West Africa and have to deal with the problem in the absence of a way of dealing with the problem. And eventually, through a lot of hard work behind the scenes that nobody sees, we negotiated agreements that dealt with the problem. And once we did establish an Ebola treatment centre, 3 times we had clinical incidents that were low risk, but of some risk of an Australian catching Ebola. They were on a plane immediately to London, where they were treated at the Royal Free Hospital, which was their centre. You don't just establish that overnight. It's extremely complex, given how difficult it is to transport patients and so forth. Why a private provider? I just described our concern about what happened if Ebola came to our region. We have the Australian medical assistance teams coordinated in Darwin, able to respond to non-health origin, natural disasters and so forth in our region. They went to the Philippines, did a great job. They've been in Vanuatu last year. They do a good job there. We had to get them ready for an Ebola outbreak in our region. That's point one. The second thing is the countries in which we operated, and we ended up operating in Sierra Leone, Australia has zero presence in that country. We have no embassy or high commission. We have no defence staff. We have no nothing. We needed to essentially run a very complex operation, an Ebola treatment centre. On some levels, it's very simple. You just basically give the patients as much hydration and salts and so forth as you can and hope that they survive. But the management of infection control is extremely complex, and we needed to be able to do that from end to end. We needed to recruit hundreds of staff locally. We needed to be able to manage all the logistics, accommodation, you name it. The government is not really very well set up to do that, and we needed to do it for potentially 9 months. In the end, we did it for about 5 months. And I should say, just in closing, that it actually worked.
So we do need to wind up, but I wonder if maybe just in 30 or 60 seconds you could let us know what's your hope for the future in global health, and particularly if there's something that you could ask the next generation to do, what would it be? So you mentioned your hope for data. Maybe if you could just summarise the next steps for us.
I think
it's working.
It's working. I think the next step and the hope that I would have for those of you working in global health is actually to work out how this collaboration works, because I do actually feel very strongly that it's got to be cross-sectoral collaboration, and that's incredibly complex. It's easier to go back into our own little silos, because that's where we feel more comfortable, and you don't have to, it's the area you know, you don't have to make compromises, etc. So I guess what I would encourage you to do is to look at what's the outcome you're looking for, what's the best solution, and then who are the partners to do that with? Because I think we all retreat back into it. And I think just to go back to the question about WHO, because I sort of feel bad about knocking their capacity, but there are big issues. They do not really feel comfortable at all working with the private sector or even the NGOs. And that's the way of the future. So collaboration is what I would ask. Look at what it is you're trying to achieve, and then who are the best people to achieve it, not just at your own sectoral interest or your own particular area.
Great. Bill, 30 seconds.
Two thoughts. One thing I would ask you to always do is think incentives. We have the technology to solve a whole lot of problems in the world that aren't solved. So there's a translation problem there, and it often comes down to incentives. How do I create the right incentives to allow that neat technical solution to a problem to be rolled out to the last person in the last village in the most remote province? That's a big challenge. So the bit more broadly, my second injunction to you guys would be to seize the opportunities, but don't avert your eyes from the risks, which is the purpose of my presentation today. There are new problems out there. Climate change is another one. We have to actually face them front on and deal with them and not pretend that they're going to go away.
Thank you. We'll join me in thanking Helen and Bill.